Please welcome to the virtual stage, Hebrew SeniorLife Board Chair, Jeffrey D. Drucker.
Good evening. One of the things I look forward to most as Hebrew SeniorLife's Board Chair is our annual trip to see Florida supporters, and not just because it's a chance to escape the cold weather for a few days. My name is Jeff Drucker, and while I'm sorry we can't be with you in person, the great news about a virtual event is that we're not bound by geography. So we're happy to have more people joining us tonight from Florida to Massachusetts and beyond. While tonight's event is virtual, the goal is still the same: to share how Hebrew SeniorLife continues to make progress in redefining aging. We hope that you'll come away from tonight with at least one thing that you're curious to learn more about. We'll close the program with a lively musical performance from New Orleans. More on that later. In a few minutes, you'll hear from Hebrew SeniorLife's President and CEO, Lew Woolf. He'll provide a glimpse of Hebrew SeniorLife's response to COVID-19 and highlight the ways that despite a pandemic, we are continuing to innovate so all seniors have the opportunity to live with purpose and dignity. We are also incredibly proud to share a message with you tonight from Massachusetts Governor Charlie Baker regarding the role HSL played in the state's response to the pandemic. Those of you who attended Engage may recall seeing it that night, but we are so proud of our collaboration with the state that I wanted to share it again. Our excellent reputation led Governor Baker and Secretary of Health and Human Services Mary Lou Sutters to call on Hebrew SeniorLife when they saw how the virus was devastating nursing homes across the state. They asked us to lead a task force that set infection control guidelines for all 350 plus nursing homes and help them develop the training, resources, and testing capabilities to meet those objectives. This collaboration truly saved lives and raised the standard of care for seniors across the state. This model is now being implemented throughout the nation. And here's the governor's message.
Hey everybody, this is Governor Charlie Baker, and it's great to be here with you virtually this year to celebrate Hebrew SeniorLife's Engage event as we recognize all the great work HSL does on behalf of our Commonwealth's aging community. Hebrew SeniorLife has long worked closely with our administration as a leader in our shared work to support older adults across Massachusetts. Over the years, and I go back a long time with these folks, Hebrew SeniorLife has continued to demonstrate creativity and innovation to truly redefine aging, helping seniors grow, learn, and reach their highest potential. As we all know, this year has been especially difficult for our aging community and the men, women, and organizations that serve them. But Hebrew SeniorLife has stepped up to meet this enormous challenge. In April, when COVID-19 first erupted across Massachusetts, Secretary of Health and Human Services Mary Lou Sutters and I called upon our trusted partners at Hebrew SeniorLife and the Massachusetts Senior Care Association to join a task force that set infection control guidelines for all of the Commonwealth's 350 plus nursing homes. HSL and MSCA quickly organized a central command team to develop and implement these guidelines with the support of $130 million in additional funding from our administration contingent on meeting infection control objectives. HSL leveraged its deep knowledge and networks to help senior care facilities implement these objectives, saving lives and raising the standard of care for seniors across Massachusetts. I'm proud to say that according to the Journal of the American Geriatric Society, this collaborative effort to stem the tide was so successful that it could serve as a model to the rest of the United States. Thank you to the entire team at Hebrew SeniorLife for your continued hard work to serve our older adults now more than ever as we continue to battle this pandemic. I'm especially grateful to your frontline staff who are heroes not only to your organization but to our entire Commonwealth. And I want to thank you also to the President, CEO Lew Woolf, for your steadfast leadership serving seniors and your partnership to stand up our infection control task force. We look forward to continuing to work together to make Massachusetts' senior care ecosystem the strongest it can possibly be. And I want to thank you for having me, and I hope you enjoy the rest of your evening. And I just want to close by saying that, as I said in my remarks, I go back a really long way with this organization, several name changes, in fact, and it's always been, in my view, one of the best, strongest, most creative and imaginative organizations worrying about, taking care of, and thinking about how we deal with aging here in Massachusetts anywhere, and we are enormously lucky to have you. Thank you.
Tonight, in a special fireside chat format, Dr. Lew Lipsitz will share tips and the latest research about staying healthy as we age, a topic that's become more relevant than ever. Dr. Lipsitz is the director of HSL's Hinda and Arthur Marcus Institute for Aging Research. He spent his career researching ways to redefine aging by mitigating the impact of age-related challenges and promoting healthy lifestyle choices. For example, he is currently leading a study on the potential use of flavonoids, compounds found in coffee, tea, and berries, to enhance cognition and improve gait. I have no doubt that Dr. Lipsitz will leave you with some new tips to apply to your own life. I am so pleased that fellow HSL board member Ellen Zane will be interviewing Dr. Lipsitz tonight. Among many other impressive titles, Ellen is the CEO Emeritus of Tufts Medical Center and has a deep background in healthcare. Ellen remains involved at Tufts Medical Center as Vice Chair of the Board of Trustees. She also holds faculty appointments at Tufts University School of Medicine and at the Harvard T.H. Chan School of Public Health. I look forward to hearing their discussion. As you listen to our speakers, I hope you'll take pride in the fact that Hebrew Senior Life's work is all made possible by you, our donors. Because of you, we have kept seniors safe, healthy, and engaged throughout this pandemic. You've also allowed us to continue to think big about what people need in order to thrive as they age. We've spoken about the Age of Opportunity campaign at events before, and you might be wondering if the campaign vision is still a priority. The answer is absolutely. And in fact, it's even more important today. Philanthropy from campaign donors has provided the foundation for Hebrew Senior Life's proactive, effective response to the pandemic, and it will continue to provide the resources to lead us into the future, something Lew Woolf will share more about in a few minutes. As you may remember, the Age of Opportunity campaign focuses on 4 areas: memory health, research, the ways we go above and beyond in our programming to care for our seniors, and the revitalization of our flagship campus. Here's just one example of the progress we've made on our vision. Almost 1 year ago, we completed renovations to the 6th floor of the Berenson Allen building on our Boston campus to provide a more enriching atmosphere for our long-term chronic care patients. We've created more single rooms and built attached bathrooms to provide more privacy. We've designed a kitchen where a chef is available throughout the day to make custom meals for patients. In addition to providing a more home-like environment for patients of all income levels, these features help our staff maintain physical distancing and control the spread of infection. Donors funded this renovation, and we will continue to raise donor support to renovate the remaining floors. This is just one example of the many initiatives we're pursuing to bring health and a high quality of life to seniors during COVID-19 and beyond. We're now in the 4th year of the Age of Opportunity campaign, and we're incredibly proud and thankful that so far, donors have committed more than $85 million towards our goal of $125 million. As a nonprofit, it's essential for us to continue to engage with our supporters, especially in the most challenging times. You've partnered with us through the pandemic, enabling us to keep our residents and patients safe and continue in our efforts to redefine aging, not just for people in our care, but throughout the world. Thank you from the bottom of our hearts. And now, I'm happy to welcome Hebrew Senior Life President and CEO, Lew Woolf, whose steady direction and drive for excellence is exactly the leadership we need during this time. Lew?
Hello, everyone. Thanks so much, Jeff, and thanks for the opportunity to talk a bit about our response to the events of the past year and how it will impact how we move forward into the future. Throughout my 11-plus years at HSL, I've become accustomed to the amazing character and commitment of our 2,600 staff members. But during this last 12 months, that character and commitment have reached extraordinary new heights. In healthcare, most senior care organizations sent the majority of their COVID patients to the hospital, which can be so detrimental and disorienting for much of our older population, and not optimal for those other patients in what was a highly overrun healthcare system. In the vast majority of cases, our staff cared for our residents and patients and accepted COVID-positive patients from hospitals. In each case, providing expert care, deep compassion, focusing on each patient's chosen goals of care given the situation. In housing, we optimized infection control procedures and minimized the impact of isolation with a vast array of concierge services and virtual activities. We even trialed pool testing program with MIT, which has become the standard for Massachusetts opening schools across the Commonwealth. And we've now vaccinated well over 90% of our patients and residents and over 2/3 of our staff, as well as some other populations like the 75-year-olds in Canton. And in research, we contributed to the knowledge around COVID-19 with efforts ranging from the inclusion of seniors in testing and clinical trials to how best to manage patients with COVID with their goals of care in mind, to vaccine approval and now equitable distribution. And in teaching, as Jeff and the governor mentioned, we took a leadership role in the creation and management of the COVID-19 infection control program that had so much success, educating the state's almost 400 nursing homes on best practices throughout the spring and significantly reduced the infection rate that they were experiencing. And we're now leading the Massachusetts component of a similar program nationwide. Over the past 12 months, I've received absolute raves about our extraordinary staff, from residents, from families, from trustees, from government officials, really from everyone. And when I've told this to our staff, which I love passing along praise to our staff, they've actually had a very, very different reaction. They did not see what they did as extraordinary, but for them, really very ordinary. In fact, it's what they always do. Their commitment to outstanding care for what's often a highly vulnerable and frail population, balancing that with seniors being engaged and active and living their best lives, no matter what barriers exist. And of course, leading the way by researching and teaching best practices to lift the entire industry. With our staff, what's extraordinary is actually not what they've done over the past year. What's extraordinary is who they are. And that is really at the core of what makes its HSL so special. As Jeff mentioned, philanthropic support from the community has been extraordinary over the last year. We have had census impacted in spots, mostly due to regulatory restrictions on our admissions, and expenses have certainly been up with extra staffing, with screening and testing and tracing, and now vaccines. And the support we've received from the community and you all has been absolutely amazing. As we move forward, our commitment to redefine the experience of aging has become even more important and more challenging over this past year. Americans continue to enter their senior years in record numbers, with 10,000 people turning 75 every day. The percentage of older adults suffering from dementia continues to grow, and the percentage of older adults who are suffering financial insecurity also continues to grow, exacerbated by the pandemic. And now with the devastation that older adults and underserved communities have experienced this year, there's even greater need for more environments that better protect older adults while keeping them healthy and socially engaged and active. So many of us heard the words of Amanda Gorman at Joe Biden's inauguration. In addition to the critical racial justice context to which she was referring, her words resonated with me regarding our country's growing challenge to support our older adults as optimally as possible. She started her poem with the question, when day comes, we ask ourselves, where can we find light in this never-ending shade? And after an amazing recital of her brilliant work, she ended with, there is always light, if only we are brave enough to see it, and if only we are brave enough to be it. When it comes to the challenge that we face in redefining aging, we at HSL are brave enough to see it, and with your help, we are brave enough to be it. In healthcare, Jeff mentioned the fantastic renovations in the Berenson Allen building in Rosendale. We paused for a bit on those renovations because we needed to assess the impact of COVID on people's desire to be in these congregate settings. Well, the jury is in on that, and people are returning to us in droves. We have a very long waiting list. There is even greater need now for the private rooms, the private baths, the private showers, and the more common areas that the renovations afford us. And we continue to grow our Center for Memory Health, as too many families still struggle with dementia and have nowhere to turn for safe and truly capable comprehensive care, and we're growing and growing in our help for that. In senior living, we're moving forward ambitiously with our commitment to expand, particularly in support of affordable housing. where older adults can get the care they need, the engagement they need, and enjoy the safety of their own apartment. Expansion plans are underway at Simon C. Fireman Communities, Center Communities of Brookline, and several additional projects that are underway, including, very excitedly, a just approved project by the state for an affordable senior housing community in Upham's Corner in Dorchester, supporting a highly vulnerable and affected population and returning to our HRCA roots very near to Queen Street. And our research, teaching, and many other programs continue to grow in scope and in impact. As it has been in the past, philanthropy must play a major role in our growth going forward. Even after the brunt of this pandemic, we are financially very strong and able to support our ongoing programs without any need from philanthropy to keep the lights on, as they say. But we do need support to grow as comprehensively as the need in society requires. It has been a very challenging year for us, but a very fulfilling one as well, thanks to our extraordinary staff and to you for your support. As we go forward, our commitment to redefining aging is more important than ever. And now I'd like to introduce HSL board member and CEO Emeritus of Tufts Medical Center, Zane. Ellen?
Thank you, Lew. So good to see you all, and good evening to everybody. My name is Zane, and I'm a very proud board member of Hebrew Senior Life. I'm also the CEO Emeritus at Tufts Medical Center in Boston. This evening, I am particularly privileged and honored to have the opportunity to interview in our fireside chat Dr. Lew Lipsitz, our Chief Academic Officer at Hebrew Senior Life and Director of the Hinda and Arthur Marcus Institute for Aging Research at HSL. In addition, Dr. Lipsitz is a professor of medicine at Harvard Medical School and the Chief of Gerontology at the BI Deaconess Medical Center, as well as Editor-in-Chief of the Gerontological Society of America, Journal of Gerontology, Medical Sciences. Following our conversation on healthy aging this evening, Dr. Lipsitz will be answering questions that many of you have already sent in, and we will try to deal with as many questions as possible. So without further ado, let's start our fireside chat. Good evening, Dr. Lipsitz, and my first question for you is, in your view, what are the top 3 to 5 lifestyle changes that you recommend for people of any age to live more healthfully?
Well, thank you, Ellen. It's truly a pleasure to be here with you. I think I would answer that first question by pointing back at you. From what I understand, you're now in Longboat Key, where it's bright and sunny and beautiful, and clearly that will add years to your life. But in all seriousness, the answer that I would give to your question about lifestyle changes is 3 things. And I think the first everyone knows, and that is increase your physical activity. We tend to become more sedentary with age, and it is really critical that we spend at least 30 minutes a day, 5 days a week in some type of physical activity that draws a bit of a sweat. And generally walking is fine. It doesn't have to be all at once. It can be 10 minutes at a time, but that is a very important activity that really will add years. The second is obviously maintaining a healthy weight and nutrition. This is not so easy, but if one follows a Mediterranean diet with plenty of fruits and vegetables, whole grains, nuts, olive oil, fish, those are the kinds of things that can truly improve your life. And finally, social engagement. And this has been particularly hard during COVID, but maintaining an active social life, meeting with other people, talking to other people, participating in activities is really critical to a healthy, long life.
Wonderful answer. And sadly, there are no surprises. We all know what we have to do. We just have to think about doing them, right?
Absolutely.
So, our next question, is there anything that we can do to prevent memory loss as we get older? It's a really current question that a lot of us are asking.
Absolutely. I think that our concerns about Alzheimer's disease and dementia are really overwhelming. This is really one of the big challenges for our current decade and beyond. And there are some things that we can do. First of all, I think we need to realize that some changes in memory are normal. It is common that we all forget names of people. People are usually pretty forgiving about that. But when memory loss begins to interfere with our ability to perform our daily activities, that's significant, and we need to prevent that. And there are several things we know. One thing that I don't think everyone realizes is that hypertension is a risk factor for memory loss. So early in life, it is very important for you to get your blood pressure checked. And if it is elevated, and by elevated, we now have lower thresholds. Anything above 130/90 is elevated. We should be treating hypertension throughout life in order to prevent cognitive decline. Again, what's good for longevity is good for your brain, and physical and mental activities are critical. The same prescription for physical activity that I mentioned before also helps your brain, but so does keeping mentally active. Reading, engaging in conversation, attending movies and activities that stimulate you are important, but don't just go and forget about them. Talk about them, interact, engage. That's really critical. There are dietary interventions as well. There's something called the MIND diet, M-I-N-D, and you can look it up. It's very much like the Mediterranean diet, and it has been shown to reduce cognitive decline in older age. And finally, I'd like to just emphasize certain medical related things. Depression is a cause of cognitive impairment. So make sure that you are checked for that and that you treat it appropriately. Don't be embarrassed. It is a disease that can be treated and can improve cognitive function. And finally, watch your medications. There are many medications on the market and many over-the-counter medications that really wreak havoc on your brain. And one of them is Benadryl. It is in everything. It's also called diphenhydramine. It's in cough syrup. It's in over-the-counter cold medications. It's in things that are marketed for sleep. Don't take it. It can cause confusion. So let me leave it at that to try to answer that question.
Very sage advice. Thank you. That's wonderful. Next question. Are there any advances in the cutting edge research that you're involved in and others relative to aging that make it possible for us to live longer and healthier lives and enjoy our children and grandchildren even more?
Yes, this is a very, very exciting area of research. It's called geroscience. We now know that aging isn't just a inevitable random kind of thing that happens to all of us over time, but aging can be regulated. And you may be surprised to find out that the way that we can actually regulate aging is through caloric restriction. If we reduce the number of calories that any organism takes in, we can expand their lifespan and reduce cancers and other adverse events dramatically. It's just nobody wants to undergo caloric restriction. Who wants to, reduce their calories in your diet? So we're now looking at why it is that caloric restriction is so powerful in expanding life. And we're beginning to understand the pathways in the body and the mechanisms that lead to aging. And if we can cure aging, then we can cure the diseases that are associated with aging. So a couple of things that we've learned. One is that there are cells in your body that stop dividing after a period of time. Those are called senescent cells or old cells. And we used to think they just sat around and did nothing. But we now know that senescent cells produce toxins that poison your immune system and poison other parts of the body. And we also know that there are various medications that can get rid of senescent cells. Actually, some of these are from fruits and vegetables. Polyphenols and flavonoids can actually get rid of some of these senescent cells. So we are studying ways of eliminating them and increasing lifespan and the quality of life. Antioxidants, you've all heard of, those too can improve your longevity and get rid of some of the toxic chemicals in your body. And the best antioxidants are those in the Mediterranean and MIND diets. Fruits and vegetables, particularly berries, have a lot of antioxidant. So yes, there are some exciting advances, and we're hopeful for some improve longevity in the near future.
Wow, fascinating, and thank you. I think during this part of the program, we have time for another question. So let me ask you about the fact that we all keep hearing a lot of conflicting information in the news. One day we hear that aspirin is good for you. The next day we hear it's not, caffeine, vitamin D. Can you enlighten us as to how we should think about this conflicting information?
Yes, Ellen, thank you for that question. It's really in everybody's minds, and it leads people to mistrust science. So I think we need to understand something about this scientific method. The way we know whether something works or not is through what's called a randomized clinical trial, an RCT. We take a group of people and randomize them to the intervention like aspirin or vitamin D, and then we have another group that gets a placebo. And the investigators don't know which is getting which. And at the end, after we've given it for a period of time and measured outcomes, we break the code and look to see who does better. Now remember, these randomized trials are scientific experiments that have to be done on a select group of people. So the people that we study are usually pure. They don't have anything else going on. They don't have any diseases. They don't take any drugs. They don't smoke. They don't drink. They don't look like real human beings, to be honest. So sometimes these randomized controlled trials are applicable to a group of people that don't represent you or me. And for that reason, when another trial is done with another group of people, we may get different results. So basically, at the end of the day, when multiple trials are done, we can combine all of the data in what's called a meta-analysis or in other types of statistical methods to determine whether, in fact, the answer is yay or nay. When we found that aspirin, which we used to give to everybody, we now know works with people who have heart disease, but it doesn't work so much in people who don't have heart disease. So we refine our knowledge as we go forward. Science is an iterative process. We get smarter and smarter, but we have to do multiple experiments to get there.
Thank you so much. And now I think what we'll do is transition to some of the questions that our audience have put forward even before today. So the first one is going to be about over-the-counter supplements. And we all hear so much about Prevagen, about Neuriva. And do they, in your view, really make a difference in brain health, in our memory? There's so much advertising around this. We all get bombarded with this kind of information. In your view about their true value would be helpful.
Yes, thank you for that question. A lot of money is being made from over-the-counter cures that are intended to improve memory or a variety of other aspects of health. They may be founded on small experiments in animals that maybe showed a little bit of a change, maybe not. But in general, they do not work. I know people have reports that, oh, I felt so much better after I took Prevagen or whatever. But remember, there is a very strong placebo effect in any trial. Just taking a sugar pill can make people feel better. So we have to be very careful as to what works and what doesn't. If you feel better and you're taking it, great. But remember that everything can have adverse effects. Many of these drugs can interact with other drugs you might be taking, or it can cause side effects that can be toxic and dangerous. In fact, anything that you see advertised on Google or over the counter that hasn't undergone a serious randomized clinical trial is not worth wasting your money to take. So let me really warn you that some of these things can be dangerous, and I would trust the randomized trials. You can look them up on clinicaltrials.com. And also, it's not always one trial. Sometimes you want to look at several trials to make sure that there's a consensus of opinion about a given medication.
Thank you for that. We have another really interesting question on exercise. You mentioned how important it is earlier, but can you talk about folks that perhaps don't have any significant chronic diseases or health issues, and they're in their 60s? What, in your view, is the best kind of exercise for people to consider?
Well, exercise is important no matter what it is. The best kind of exercise is the exercise you will do and that you enjoy. So, why should you play golf if you don't like it? But if you like it, that's fabulous exercise. That's my quick answer. Exercise in whatever way you enjoy. For those people who may have some disability or arthritis, walking is just fine. Try to get in 30 minutes a day. It doesn't have to be all at once. For those who want more vigorous exercise, certainly playing sports, tennis, skiing now in New England, whatever. Swimming is fabulous because it takes the pressure off your joints and is really excellent cardiovascular exercise. And try to get in a little weightlifting if you can to try to improve your muscle strength. One of the things about your question that's really important is it as important in somebody who is already pretty healthy? And the answer is yes, it's still important for all of us. And the reason is this, it's a concept called reserve. We want to increase the reserve in our body. We want to have enough extra capacity so that if we do get sick, it does not disable us. So if we have more muscle strength than we need for everyday activities, and we get sick and lose some muscle strength, we're still going to be able to participate in those activities without becoming disabled. So we want to create reserve, we want to create extra muscle strength, we want to create extra cardiac ability. So exercise does that and is also a brain reserve. It actually increases our ability to think more clearly. So exercise is important at all ages for everyone. COVID has taken its dent on that, but we need to be creative. Climb your stairs, do workouts in your home, whatever works, whatever you enjoy.
I've learned that Zoom workouts work just fine. So it really does work. You mentioned skiing, for example. So talk to us. We have a wonderful question here about how to prevent falling, because it's something everyone fears at any age. So talk to us a little bit about that.
Yes, falls are devastating. They are often the beginning and the end. If people break hips, they can really become severely disabled. Well, there are a couple of things. Again, you're going to hear the recurring theme about exercise, but in this case, we want to increase our muscle strength as well as our aerobic capacity. So, weightlifting exercise is hard. You need some equipment, but you really can, everybody can do it. And the muscles that you want to strengthen are the muscles that are involved in walking, stair climbing, and standing up from a chair. So the way to do that, these are your quadriceps in the front of your thighs and your gluteus muscles in your butt. And the way to strengthen those is through leg lifts. You can sit in a chair and put a Velcro weight around your ankles, lift each leg 10 times. When you get to the top, count to 3 and put it down again, 3, put it down again, 10 times on each side, a couple times a day, 3 days a week. That's great. And when that gets easy, add some weight. Stair climbing, doing squats, all can increase the strength of your thigh muscles. And we know that can prevent falls. And people can do that up to age 100. I mean, we've studied that and shown it's very successful. The other thing is to avoid sedating medications and alcohol. We all enjoy a drink or two, that's probably okay, but more than that, or if you don't tolerate it, is dangerous. Alcohol can certainly dull your senses, but so can the sleeping pills that people take. The Benadryl I mentioned earlier, any sedative is a high risk for falling. We want to optimize our vision and hearing. We often don't go to the eye doctor or the audiologist often enough. Don't be embarrassed to wear a hearing aid or glasses. They can prevent falls. And beware of bifocals. Bifocals are for reading when you look down, but if you're walking and looking down through a bifocal lens, the floor is going to be out of focus. So be careful. If that's the case, you have bifocals and you find that the floor is out of focus when you're trying to walk, ask your eye doctor for 2 sets, a reading set and a distance set of glasses. We think that vitamin D and calcium are also helpful in preventing falls, and they are particularly helpful in preventing bone loss. And of course, the fall is dangerous if you break a bone. So get your bone density exam. Even men can get bone density exams. If you have osteoporosis, take a medication for that. The medicines are safe. There are very rare instances of atypical fractures from Fosamax or others, but for the most part, they are very safe and they prevent the dangers of fractures. So those are some of my recommendations regarding falls.
Fantastic, thank you. We got a very interesting question from someone who was interested in knowing about retirement and the effects of retirement. What do you think about the effects of longevity on mortality and morbidity for people who decide to stay in the workforce versus retiring?
Yes, it's a very good question. And what's really important is what you do in retirement, not whether or not, but what you do. And what you should do is maintain a sense of purpose. So do something that has some meaning. It can be with your grandchildren, or it can be a volunteer work somewhere else. That is critical. And avoid loneliness and isolation. Loneliness has been equated to smoking 15 cigarettes a day.
Wow.
So people who are isolated and alone in their own house, they don't go out, they can't, they are at risk. On the other hand, is working. Well, working is great. It gives you a sense of purpose, it avoids loneliness, but if it creates too much stress, then it's not good for you. So you need to create that balance. If you're finding that work is stressful, it's not enjoyable, then retirement may be right for you. If on the other hand, it gives you a sense of purpose, you feel like you're contributing something and you're interacting with others, then continuing to work is certainly a good thing. So that's the way I would balance it. Maintain a sense of purpose, avoid loneliness, and interact with others.
Interesting. My husband always said after I decided I was retired from a day job, that it was a big lie because many of us remain very busy and it feels good to do it on your own terms. It really does.
Yes, and that is the key to longevity, to keep busy. Absolutely.
Keep busy. Talk to us a little bit about napping. How much sleep do we need, and is napping a good thing?
Yes. Well, everybody needs a certain amount of sleep. Sleep is very, very important for health. And you'll know better than anybody how much you need because it's a lifelong need. I mean, the amount that you had as a younger person, if you were a 6-hour person, you need 6 hours. If you're a 10-hour person, you need 10 hours. The napping can reduce the amount of time that you sleep at night. Napping's okay as long as it's for short duration and that you basically get the rest of your hours overnight. But don't be surprised if you reduce some of the time at night. Sleep quality gets impaired as we get older. We don't have as much deep sleep, but if you're finding that you're awakening frequently, that you're having vivid dreams or moving during sleep, you should see a doctor. Or if you're feeling very, very sleepy during the day and not getting enough sleep, it could be you have sleep apnea or another condition that impairs your sleep. The average is about 8 hours. Everyone should get at least, should probably get that unless they have a lifelong habit of less than that.
That's great. Thank you. We have one more question, and that has to do with the impact of financial insecurity and the kind of stress that brings on, and how, in your view, that affects one's overall mental well-being as one ages.
Well, I think at any age, financial insecurities are very, very challenging and important. And many people do enter retirement without sufficient funds to be comfortable. It's an enormous stress, there's no question about it. And I think the only answer is to prepare earlier in life for the possibility of financial problems later. One of the things we do have in our country is Medicaid, which is a safety net for those people that have to enter nursing homes and have to spend down their assets and all the money they might have in a house. Medicaid becomes an option. It does pay for long-term care. Medicare does not. Some people who do have assets, such as those who live in their own home and the mortgage is paid off, might want to improve their financial security by moving into a continuing care retirement community, such as our Orchard Cove or Newbridge on the Charles. That is an insurance policy. You can turn the assets from your house into a beautiful apartment and get services if you ever need them, have a nursing home on site if you ever need that, and a quality of life that really embraces all the things we've been talking about, including activities, social engagement, sense of purpose. All of that is built into these types of facilities. And organizations like Hebrew Senior Life are really leaders in providing a quality existence for those and financial security if you're able to move into such an organization. For those who can't, places like our CCB, Coolidge Corner facility is also a place that people of lesser means can move into. So that's how I would address financial security. Thank you, Ellen.
Thank you so, so much. Your advice and your wisdom are so practical, helpful for people. We're very, very grateful for all you and your team do. Thank you so very, very much for this time today. And now let me turn it back to Jeff.
My pleasure. Bye.
Thank you, Ellen and Lew, for that interesting and informative conversation. We're so glad that so many of you were able to join us this evening. Thank you for your time and continued support. Please feel free to contact the team at HSL if anything you've heard tonight has especially piqued your interest, or if you have any questions. We're always grateful for the opportunity to get to know you better. I'm now happy to introduce our musical guests, who prove that in the life of a New Orleans musician, there is no such thing as retirement. This special quintet is led by trumpeter Wendell Brunius and features Daniel Farrow, better known as Weenie, who's been playing saxophone professionally since 1945. Please sit back and enjoy two selections of toe-tapping, authentic New Orleans jazz, like a visit to the French Quarter, but in the comfort of your own home. Let's hope that next year we're able to come together in person once again. Please enjoy this special performance. Be well, stay safe, and have a good night.
Hey everybody, we're coming to you live from New Orleans. Thank you to the Hebrew Senior Life for having us. I'm Wendell Brunius, and all together we make up more than 350 years of performing New Orleans jazz. We sure hope you enjoy us. Thank you. Marching in, when the saints go marching in, you know that I want to be right in that number. Now when the saints go marching in, and when the sun refuses to shine, when that sun refuses to shine, you know that I want to be in that number. Now when the saints go marching in, let me tell you, now we're all walking in the footsteps of the ones who've gone before. Oh, but we'll all be reunited